Hi everyone, how you doing? Today, let's look at a case which didn't go to plan. Not only did it not go to plan, I feel like we got a hiccup or a problem at every single stage of this treatment. Now, the before and afters will look dramatic here. It's effectively an all-on-4 with 4 zygomatic implants at the top. Actually, 6 implants, 4 zygomatics, and I'll come on to the other ones in a minute. And then we rebuilt the lower teeth. We kept the natural teeth, okay? And you know that I'm a big advocate of keeping teeth where we can. Now, we did this consultation for this lady in lockdown. I remember I was doing video consultations at home, and I remember speaking to her a long time ago, and she lives about 2 or 3 hours away from the practice, so it wasn't really easy for her to come in when the whole lockdown thing finished. Anyway, I heard her story, and it was clear she didn't have any teeth at the top, and we needed to do something. And she had had other consultations, and the dentist had told her that there's no bone for dental implants. So it sounds like we need to go down the route of zygomatic implants. And I've done other videos on zygomatic implants, but to explain it really quickly, these implants don't go in a normal position. They kind of go into the zygomatic bone, which is your cheekbone. Now, the first thing we need to do in situations like this is take a CT scan, but it isn't just a normal CT scan. It needs to be a bigger CT scan to capture the zygomatic arch, the cheekbones. So there's loads of scanning centres dotted around the UK, and it turns out there was one which was fairly close to her. So I did a prescription, and she went over, she travelled an hour still, and she had this CT scan done. The CT scan company sent me the scan, and it turns out they didn't take the zygomatic scan, which is incredibly frustrating. Anyway, they admitted it was their mistake, and then we got a full scan done. And from that information, we were actually able to book her in straight for treatment. Now, at the time, I didn't do zygomatic implants myself, so I got a colleague in who often helps me with these cases, and he placed the zygomatic implants. We've got 4 of them, and you can see them on this x-ray. They look extremely long compared to a normal implant, and that's because they are long. They're like 4 or 5 centimeters long. They engage in the cheekbone here, and we've got these 4 anchor points in the mouth. So if you were just to look at a picture in the mouth, you'd think this is just a normal all-on-4 treatment. And we kind of treat it like a normal all-on-4 treatment as well. So the patient left with fixed teeth on the day, and we just let everything heal for 6 months. Now, in the lower jaw, what we did was we removed all of the decay from the teeth and prepared these teeth for kind of wraparound veneers. These are slightly more aggressive than a normal veneer, and that's because there was lots of decay on the sides of these teeth. Anyway, we cleaned it all up, we prepared those teeth for veneers, and we placed 4 implants at the bottom so she could have an extra 3 teeth on either side, fully restoring the lower arch. And we just got on with the lower teeth because it was a kind of a straightforward scenario, and we left the top teeth. Now, as the top teeth were healing, she complained that one of these implants didn't feel like the others. It wasn't like pain, but it just didn't feel quite right. Anyway, we saw her again for a few reviews. Okay, this was a couple of months after we did the initial treatment. And I agree, one of those implants just didn't feel right. In fact, it became looser and looser as we went on, which means that the implant itself had failed. Now, when implants fail, they're typically not painful. Okay, they're just irritating, it just doesn't feel quite right. And in this case, it was really, really obvious it was loose. And what we did, we just, under normal anesthetic, we just removed the implant and we let the area heal. 3 or 4 months later, we replaced that zygomatic implant. You see, you need to wait 3 or 4 months for the bone to heal again so we're able to place another implant in position. And then you're effectively back to square one in terms of healing. So we had to wait another 6 months and have a series of temporaries, but occasionally the temporaries would break and stuff would happen. Okay, so it's incredibly frustrating for our patient. I can't believe she put up with us, and we're still on good terms, and you know, we have a good laugh every time she comes in. But I feel she had more than her fair share of adversity during this whole treatment. Anyway, we got to a point where the implants were integrated at the top and at the bottom. The bottom was pretty much finished at this stage, but the top ones we made a final set of teeth, and we used what we call an acrylic wrap. Okay, and this was a couple of years ago, and we fitted it. It needed a bit of bite adjustment, and it looks pretty good, right? It's a dramatic improvement to where we started from. Anyway, this didn't last that long. A couple of months later, she was texting texting me saying, hey, look, something just doesn't feel right about these. So we invited her back in, and this is what we found. Okay, this gold thing here is called an abutment. The abutment connects to the implant, and basically the screw in the abutment had failed. And this happened like 3, 4, 5 times. In fact, I must have spent about £1,000 just on these bloody little abutments. But we were taking x-rays and the fit of everything looked really good. This was really, really unusual. It's the only case where this has ever happened. And I knew this wasn't a good enough solution. Okay, we can't just replace abutments every 3, 4 months, even if the patient's paying for it, which obviously she wasn't, but it's not a good long-term solution. Now, one thing to realize with zygomatic implants is that they are very long, okay, and that's the main way they differ. But not only are they long, they're only really engaged at the tip, okay, so there's about 2 or 3 centimeters, usually about 2 centimeters if that, of the end which is in the bone, okay. The rest of it is actually kind of hovering outside bone. And even though it's metal, there is a little bit of flex in these implants. And you can see this if we are taking molds of the implants and we put pressure on them, you can see a little bit of flex, and this is normal. That's just the metal flexing over a long distance. Now, over time, this is what can create fatigues in materials, and I feel this is what was happening in this case. So then what we did was we placed 2 more implants right at the back. Okay, and these are called pterygoid implants. They engage in a different bone. They're shorter, and they've got less flex, or hopefully no flex at all. Now, there's very little bone anywhere else. I did try and attempt to put an implant right in the middle. I thought maybe we've got enough bone, but after a few months that one failed, and we had to just accept the 2 extra at the top and at the back. But my idea was, instead of having 4 implants with a little bit of flex in them, okay, and now bear in mind, if you've got a solid bridge connecting all 4 of these, the flex should be absolutely minimal. But I think there was still a little bit of flex, but by having 2 extra implants at the back, I think we have eliminated this little bit of flex that was still in the system. So then we just let the whole thing heal again, and now we've fitted a full zirconia bridge. But if you see my video on zirconias, it's not just a standard zirconia bridge, it's the one with a metal bar inside it to help reinforce everything. The immediate feedback is it feels really comfortable, but we're going to have to just see how this plays out. So the reason I'm telling you this story is that not every single case is an amazing before and after. Even if you jump on my Instagram, you'll see all these cases, but you don't really understand what's going on behind the scenes, and sometimes things don't go right. Now, it's our practice policy that even if things don't go right, we will put them right. There's no additional cost to the patient, but there is a lot of hassle in, having to come to see us for so many times, having extra appointments, extra surgeries, all that kind of stuff. Oh, one thing that did also happen was one of the teeth which we kept at the bottom, that needed root canal treatment. But this was a separate thing. This is kind of like a known thing that can potentially happen if we're keeping teeth. Okay, it's kind of rare, but the patient did have to pay for specialist root canal treatment to have that one fixed. But apart from that, the kind of the bridge remakes, all the extra implants, reinforcing this whole system, all of the appointments, that's kind of covered under our promise. Okay, when somebody agrees to have treatment with us, we understand they're putting a massive amount of trust in us. So the last thing we want to do is betray that trust by stacking on extra costs when things don't go right. It's obviously it's not the patient's fault that these things didn't go right. It's not our fault, but you know what, we'll just fix it. It happens so infrequently that we will just fix these things. So that's everything for this one. I hope you can see that, when you're looking at all these cases, it's not always glitz and glamour. There is a reality to it sometimes. So just be aware that if you're going down this journey, it may not be as plain sailing, but you're not the only one who has faced adversity during these treatments. If you like this video, please give it a thumbs up. Please consider subscribing, and I will see you in the next one. Take care.